My name's Buffy Ray, and I am a patient of Dr. Satey. I first heard about Dr. Satey actually through this clinic. I was a patient of another doctor here, and I was referred to him, and that's how I heard about him. I felt comfortable with Dr. Satey because I had met with probably 5 or 6 different doctors, and the majority of them were used car salesmen with a scalpel. They were very much like promising me the world, and everything was like, we can do that. You can look just like this person. And I said, that feels like delusion, and I don't want to be a part of that. So when I met Dr. Satey, he was very realistic, and he said, we can't do that. We can do this. And he was just more realistic with me, and I really appreciated that because, I mean, I like being extra, but I'm not crazy. One, I was in the journey of my transition, so that was a big reason for a lot of it. And then I had also lost 140 pounds over the last couple years. And so I just had a lot of extra skin and stuff, and I just kind of wanted to knock that out and get them done all at one time. I had quite a few surgeries done at once, and Dr. Stay made that really easy for me. So I mainly wanted to get it done for those reasons. I mean, nothing special. My main hope for this before the surgery was that I wouldn't freak out and leave before it, because it's surgery. I was excited for it and really happy, but obviously it's surgery and I'm not woohoo. So I was really nervous that I would be scared during the surgery, and that was my main fear. I kind of was prepared for everything else. I had met with so many doctors, and I had heard Dr. Satey mention all the things that could happen, that he expected to happen, and I felt really comfortable with that, but I was just so nervous about being nervous. And I remember very clearly all these people were in here running back and forth, and I walked to the operating room, and right before they put me under, Dr. Satey just patted my shoulder and was like, "You'll be fine." And I was like, okay. He's very much like a surgical teddy bear. He's very, very nice. I'm someone who likes a lot of information. I want to know everything that could happen, that might happen, that may happen. And I ask a lot of questions. That's what makes me feel better. And Dr. Satey spent a good probably hour and a half just answering questions that I had. And then from the minute that I left the office, I was pretty much able to communicate with him and the staff whenever I wanted, which was great for someone like me, because I would be what would happen if I tripped and I fell and I landed on one of the implants? Then what would happen? And Amanda would be like, I'm gonna ask Dr. Satey and get right back to you. No question was too silly for them, and I really appreciated that. The team was actually probably besides Dr. Satey, that was the big reason I chose this facility, because a lot of the other doctors that I had met, not to start a rumor, but a lot of the other doctors I had met, they were very, you're so important to us right now, but then it felt like there was no aftercare, even discussed. And with Dr. Satey and his team, I feel like I could text them in a year from now with a question and they would be just as responsive. And that is really important to me because, again, I have a lot of questions. Honestly, when I came back the next day, I almost felt like I was part of a circus. I've never had so many people staring at me and looking at me. And it was because they were all so shocked that I was walking, that I was able to do anything, because I had so much done at one time. But I had, and I'm not making this up, I'm not being dramatic. People always say I'm lying when I bring this up, but I had literally no pain. I had no pain at all. Not even a little bit of pain. I had no pressure on my chest from implants. I had no pain, period, from any of the procedures. In fact, when I woke up, I thought he didn't even do the implants because, well, one, I was so swollen, but because there was no pain, and I was so used to hearing that you're gonna feel like you have pressure on your chest, an elephant is sitting on your chest. I had none. Well, in lots of ways, honestly, for me as a trans patient, it's probably been really impactful, in just a social aspect and just feeling more comfortable socially. But on a personal level, it was really exciting to see all this work I had put in over 3 or 4 years losing this weight, to see that skin removed. That's probably the biggest thing to me, is just seeing how much work I have put in and get to reap the reward of it, because no one really tells you after you lose weight that you're gonna have all this extra skin. No one talks about that the way I think they should, and it's a whole different mental issue. And so having that removed, I was whoa, it was just shocking. It was shocking to see little things, how I fit in rides at Universal. Not that I've done that yet, Dr. Satey, but I'm just saying that could be something that's shocking to me, or how clothes fit, or just little things you never notice, being able to cross your legs and not have like extra skin in the way. Like those things are all like something that I had to think about a lot, and now it's like none of those really matter. When I look in the mirror now, I feel really excited for part 2, because Dr. Satey has planned, this is another thing that I found very incredible about Dr. Satey as a doctor, is that he's already thinking about the future of what you may want. I came out of the surgery and I was like, oh my God, like everything is perfect. And he was like, okay, well, just in case, here's, I've planned in case you have more you want to do. Like I put the stitch here, so if you did this next procedure, I could blend it in here. Like it is things that like would have never even crossed my mind. And now that I'm into my recovery and I'm seeing things like, you know what, I kind of would want to tweak this a little bit. He's like already pre-thought that out for me. I feel great, but I am very ready for because my surgery, I had so much done at once. I definitely am a case for like, it kind of has to be done in stages. Not that I mean, honestly, I could stop now and I feel like I could live totally fine, but I'm really excited to see the vision that Dr. Satey had already pre-planned out, and I'm really excited for it. If someone is considering any surgery, I would say to them to do research, like actually do research. Like don't just read like Reddit forums. Go to the doctor and ask the doctor your questions, whatever doctor you want to see. I would say talk to your primary care physician. I did that to find out like what to look for, like what is like maybe something that's kind of like a little shady or odd that a surgeon may say to you. You just really have to I think a lot of us, especially people in like my position where it's something they thought about for so long, and it means like so much more beyond like just beauty procedures. Like I think that you really want to get it done. Like you want to jump on it and get it out of the way. But like I'm so happy that I took time and I like lost all the weight and I like lived in the uncomfortable area until I found someone who was really good and could do what I wanted, because it makes all the difference. Like you just take your time. Like I would say not to rush into anything. Don't be like, well, this person can fit me in, for lipo next week. Like why can they do that so soon? Like I would ask those questions, and I would want to know, like, just ask questions. I mean, I think if they can't answer your questions, then you should do something else, I guess. I would say to Dr. Satey and the team, one, you're not done seeing me. I live right across the street, and I'll be back again. I am very thankful. I'm very I think that's still, I don't even have words, honestly. Like I'm very, very thankful for what Dr. Satey and them did for me. And I'm very, very thankful for the way that they involved me in their day to day. Like it felt like I was, again, I've said it a billion times now. It's like, it just felt like I was the only patient that mattered to them. And like, when you're having someone like literally cut you open and, move things around and stuff, like you kind of want to feel like that. You want to feel important. And I mean, Dr. Satey, you guys made me feel so special and so important. And honestly, this is maybe a little dramatic for a medical professional facility, but it really does feel like these people are like my little family in like some way.